Sarah stared at the kitchen counter, her stomach twisting into knots. Another pile of medical supplies sat there, gleaming under the fluorescent light syringes still in their sterile packaging, glass vials filled with clear liquid, IV tubing coiled like snakes ready to strike. This wasn't the first time. It wasn't even the 10th time. Her roommate, Marcus, had been a nurse for less than a year. Fresh out of nursing school, he'd landed a position at the local hospital with dreams of saving lives and making a difference. Sarah had been proud of him, even a little envious of his sense of purpose. But somewhere along the way, something had gone terribly wrong. It started innocuously enough. A few months ago, Sarah noticed small items appearing in their shared bathroom gauze pads, alcohol swabs, adhesive bandages, the kind of things you might find in any first aid kit. When she'd asked Marcus about it, he'd waved her off casually, his voice light and unconcerned. "Of course I can take these," he'd said with a confident smile. "Everyone does it. It's totally fine." But Sarah's instincts had nagged at her. Late one night, unable to sleep, she'd pulled out her phone and typed the question into Google. Her heart sank as she read article after article. Taking supplies from a hospital, even small ones, was theft. Plain and simple. She'd felt sick, hoping it was just a misunderstanding, a one-time lapse in judgment. Then the supplies escalated. No longer just bandages and swabs. Now it was syringes, vials of medication, IV starter kits with needles that could puncture skin and deliver life-saving fluids, bags of saline solution that should have been hanging next to a patient's bed. Each item represented not just stolen property, but potentially stolen care. Somewhere, a patient might be waiting for these exact supplies. Sarah had tried talking to Marcus. The first conversation had been gentle, almost apologetic. "Hey, I just want to make sure you're not getting yourself in trouble," she'd said, her voice careful and measured. Marcus had laughed it off, telling her she worried too much. The second conversation had been firmer. Sarah had printed out articles about healthcare workers losing their licenses, facing criminal charges for theft. Marcus had barely glanced at them, his jaw tightening with irritation. "You don't understand how hospitals work," he'd muttered, turning away. The third conversation had shattered their friendship. Sarah had waited for him after his shift. The newest pile of supplies spread out on the table between them like evidence at a trial. "Marcus, this has to stop," she'd said, her voice trembling with a mixture of fear and frustration. "This is serious. You could lose everything." His response had been volcanic. His face had flushed red, his eyes blazing with anger. "Mind your fucking business," he'd shouted, slamming his hand on the counter so hard the vials had rattled. "You have no idea what you're talking about." The words had hung in the air like poison gas, suffocating any remaining warmth between them. Now, 2 to 3 times a week, Marcus returned home with more supplies. Each time, Sarah felt the weight of complicity pressing down on her shoulders. She'd checked online forums, even the nursing subreddit, hoping for validation or guidance. Many nurses had compared it to taking office supplies pens, sticky notes, paper clips. "Everyone does it," they'd written. But Sarah couldn't shake the feeling that syringes and IV medications were not the same as staplers and highlighters. She imagined the patients Marcus cared for. An elderly woman waiting for her IV to be started, only to be told there was a delay because supplies were missing. A child needing an injection, their parents' worried face as the nurse searched for equipment. Maybe she was being dramatic, but maybe she wasn't. Sarah sat at her laptop, the cursor blinking on the hospital's anonymous reporting page. Her finger hovered over the mouse, her heart pounding so hard she could hear it in her ears. Marcus was her roommate, someone she'd once considered a friend. Reporting him could cost him his license, his career, his future. But not reporting him could cost patients their safety, their care, their trust in a system that was supposed to protect them. The moral weight pressed down on her like a physical force. Was she overreacting? Was she being a terrible friend? Or was she the only one willing to do what was right, even when it hurt? What would you do? Share your thoughts in the comments below. Would you report your roommate, or would you stay silent? Like, comment, share, and follow this page for more.